in the news today, lots of health stories. So Dr. Amir is joining us this morning. And Dr. Amir, I mean, you know, there's lots to get through with you, isn't there? Let's start with the front page of the Daily Mail. Hospitals hit by £5.5 million a day bed-blocking crisis. Now, this is a situation where, you know, there are so many people in hospital beds at the moment who are fit to be discharged but don't have anywhere to go. And this isn't making the situation with the pandemic backlog any better, is it?
Morning. Yes, that's right. You know, these are patients who have had their treatments completed in hospital and are fit to go somewhere else. And that usually is social care. And the problem is there isn't the beds or the staffing in social care to accommodate these people. So they're stuck in hospital through no fault of their own. This term bed blocking may imply that they are blocking a bed, but actually it's a delay in discharge because there's no safe place for them to go. And that's because there's been a chronic lack of funding in social care. There's a staffing crisis there. But we can't blame just this one thing on what's going on in hospitals, in the delays in getting an ambulance in A&E treatments, patients moving from A&E into the ward. You know, this is a long standing problem. Again, staffing issues, financial issues in the NHS, the state of how it is to work in the NHS as well, and record numbers of people leaving the NHS and social care. It's another big problem for the incoming Prime Minister to tackle, but we certainly mustn't be blaming the people who are well enough to go home from the hospital simply because there is no safe place for them to go.
It must be incredibly frustrating if you're working in those hospitals. Something in the front page of The Guardian, I mean, this is a damning story, revealed Black and Asian cancer patients wait longer for diagnosis. So this is the University of Exeter, a study that they've done. Damning, I say. I mean, it's deeply concerning. It's completely unacceptable. So if you're from an ethnic minority, so you wait longer for treatment. So, for example, for cancer treatment, you wait, in 6 out of 7 cancers, you wait longer if you're Black and Asian for treatment. How is that happening? How is that allowed to happen?
Yeah, this is really worrying. You know, we've known about disparities in health outcomes, particularly cancer outcomes, when it comes to Black and minority people compared to their white counterparts. And this is just another piece of that evidence. It looks at 126,000 people over a decade and the time it takes for them to present to their doctor with their symptoms and to get a diagnosis and start treatment. And there is a big difference between Black and minority ethnic people compared to white people. We don't really understand why, and that's where research and money is needed to get these things back up and get that disparity sorted, because the reasons are unclear. But it could be that the GP delays the referral in certain minority groups. It could be that secondary care aren't taking them up as quickly as they should do.
I mean, why would that happen? Why would a GP delay the referral for someone because of their skin colour? I mean, I'm not suggesting anyone's racist, but why would you do that? Why would that happen? Is it because it presents itself, the cancer, in a different way in an ethnic minority?
It's really unclear, Sean. I've tried to look at the data to see what the causes are, and there's no specific cause. It could be that people from minority backgrounds present in different ways with their cancers. It could be that they don't articulate it as well when they go and see their doctor, or their doctor isn't good at picking it up enough. It's just really unclear. What we do know from previous research is that people from minority backgrounds aren't aware as much as white people about cancer symptoms, that they don't attend screening as much as they should do. And even when they are symptomatic, they may not present. So we need research, we need money to target this particular problem, and we need cancer awareness campaigns targeted at Black and minority ethnic people too.
Yeah, it is shocking. It's, you know, the government, NHS, have repeatedly said that they're going to tackle these inequalities, but more needs to be done to find out exactly what's going on behind it, doesn't it? Without a doubt. Something else, people who are considering their breakfast choice this morning might want to pause. I'm reading that an extra inch on your waistline can increase your heart risk.
Yeah, I mean, everyone knows that being overweight or putting on excess weight increases your risk of heart disease. But actually what we've known for a long time, and this adds to that, is this thing called central obesity, or weight around your waist area, actually specifically increases your risk of things like heart disease and type 2 diabetes, because fat collecting there is a good indicator of fat on the inside as well, on the inside of your organs, on the inside of your blood vessels. And that increases risk of things like inflammation and insulin resistance, which then lends itself to things like heart disease. So it's far better when you're looking at risk factors to look at weight or fat around your waist when compared to things like crude measurements like body mass index, which doesn't really specify certain illnesses like heart disease. So yes, people should be looking at weight around their waist. It's not ideal. It's not, it's not a nice thing to do, but it is a good indicator of heart disease to come.
I was just actually pinching myself.
I wondered what you were doing there. It does say for every inch you can pinch, and you're just having a little check.
I can pinch more around the front than the back. Does that help? Is that maybe 1.5 or? Help me.
It's more a comparison of kind of the weight around your waist compared to your thigh circumference. So you shouldn't really have, more than double a waist circumference to thigh circumference.
I've got quite thick thighs, so that's good, isn't it?
Was that the answer then? Just get thicker thighs as a consequence. Dr. Amir, thanks very much. Good to see you this morning.